I'm scanning my room, the walls, the floor, the ceiling in here is good. Floors, my table, I just have this on. There's nothing on the walls, the ceiling. Okay. All right. Into the patient's room. Washing my hands, performing hand hygiene. Hi, my name is Mary Delgado, and I will be your nurse practitioner today, performing your head to toe. First thing, starting my exam, I will assess her skin. I'm assessing her face, her head, her neck, her posterior chest, anterior chest, her abdomen, her arms, and her upper extremities and her lower extremities. I'm looking at the color, texture, temperature, turgor, moisture. I'm looking for any lesions, scarring, bruising, edema, or nevi. Her skin is normal for ethnicity. It is warm, elastic. It is bouncy. There's no signs of edema, bruising, or any nevi throughout all of her skin. Next, I'm going to look at her head. Her head is midline, it is symmetric, it is proportional to her body. I'm going to look at the scalp. I'm feeling, is there any tenderness?
No.
As I palpate, no tenderness. I'm looking for any infestations, any lesions, any masses. Head is normocephalic, skin is, scalp is appropriate. Hair is evenly distributed throughout the entire scalp. Hair is blonde, fine, smooth, and straight. I'm looking at feeling her temporal arteries now for any tenderness.
No.
Okay, I'm gonna feel her lymph nodes for any abnormalities. I'm feeling the preauricular lymph node, postauricular, occipital, tonsillary, submandibular, submental, anterior cervical, posterior cervical, supraclavicular. Next, I'm going to feel her masseter muscle or TMJ. First, can you clench your jaw? Can you open and close your mouth? No subluxation, no crepitus, and no tenderness, correct? Good. That also assessed cranial nerve 5, the trigeminal trigeminal nerve at her jaw. If you will close your eyes for me, can you tell me when you can feel this?
Yes, 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 yes.
Cranial nerve 5, the sensory aspect of cranial nerve 5, facial sensation appropriate. Tell me when you can feel this.
Yes.
On your upper.
Yes.
Light touch sensation also appropriate in upper and lower extremities. Next, I'm going to assess cranial nerve 7, her facial nerve, by assessing the symmetry of facial expressions. So if you could smile for me. Good. Frown. Good. Raise your eyebrows. Puff out your cheeks. Pucker up your lips. Facial expressions are symmetric appropriately. Cranial nerve 7, the facial nerve is intact. Next, I'm looking at her ears. Her ears are evenly aligned. They're proportional in size. They're feeling the tragus and the pinna for any deformities or tenderness. Any tenderness? I'm going to assess the auditory canal by pulling up and back on the pinna. I'm looking inside for patency. I'm assessing the temporal membrane, which is pearly gray, and no signs of perforation. I am going to do that bilaterally. It's appropriate. Next, I'm going to assess her hearing by assessing the cranial nerve 8 with the series of tests. First will be the whisper test. If you'll cover your right ear, can you tell me what word I'm whispering?
4.
Good. Now cover your left ear.
4.
Whisper test appropriate. Next, I'm going to perform the Weber test, which is lateralization. Now, can you tell me if the vibration is heard Best midline or in one ear rather than the other?
Midline.
Weber test appropriate. Next, I'm going to perform the Ryan test to test for air conduction versus bone conduction. Can you tell me which position is louder? A or B?
A.
Good. A or B?
A.
Air conduction is greater than bone conduction. Her vestibular cochlear cranial nerve 8 is intact. Next, I'm going to look at her eyes. Her eyes are symmetric. There is no droopiness of the eyelids. Her eyebrows are full and proportional bilaterally. They extend beyond her eyes. Her eyelashes curve outward. Her beautiful blue eyes are normal. Her pupils are 3 millimeters symmetrically bilaterally. The sclera is white. Her conjunctiva is pink with no edema, redness, or drainage. I'm going to assess her cranial nerve 2, the optic nerve, next by assessing her visual acuity with this Snelling test. If you will cover your left eye and read the smallest line possible.
D-E-F-P-O-T-E-C.
Good. Now I'm going to test her peripheral vision as well in the right eye. Can you tell me which letter or number I'm holding up?
3, 2, 1,
Good.
1.
Appropriate. Now can you cover your right eye and read the smallest line?
D-E-F-P-O-T-E-C.
Next, I'm going to test the central and peripheral vision in her left eye. Tell me which number I'm holding up.
3, 2, 3.
Appropriate. Her visual acuity is 20/20 bilaterally, and her peripheral and central vision is intact. Next, I'm going to assess the cranial nerve 3, the ocular motor nerve, by assessing her pupillary response to light. Ooh. The lights in the exam room are dim. Her pupils are equally round and reactive to light. They directly and consensually retract bilaterally. Cranial nerve 3, ocular motor nerve is intact. I'm going to assess for accommodation and convergence, if you will follow my finger. Eyes accommodate and converge appropriately. Next, we'll assess cranial nerves 3, 4, and 6, the oculomotor, trochlear, and abducens nerves by assessing her extraocular movement by assessing her vision in the 6 cardinal fields of gaze. Follow my finger. Good. No nystagmus. Extraocular motor nerves are intact. Next, I will look inside her eyes. So if you will just concentrate on an object behind me. I'm assessing for negative red light reflex bilaterally, as well as observing the optic disc, which is sharp, and the fundus with no deformities present. Next, I'm going to look at her nose. It is midline. There's no redness, no swelling. I'm going to feel no tenderness. I'm assessing her maxillary sinuses and her frontal sinuses, no tenderness.
No.
We'll assess patency, blue. Breathe in and out, good. Patent bilaterally, there's no signs of deviation, and her nasal canals are patent and appropriate. I'm going to have you test your olfactory nerve, cranial nerve 1, by having you identify the smell. If you close your eyes, what is the smell?
Cookies.
Appropriate. Cranial nerve 1, the olfactory nerve is intact. Next, I'm going to look at her lips. The lips are pink, they are moist, they are symmetric with no drooping. Now smile, let me see your teeth. Teeth are they're white, they're straight, they are all intact. Now let me see your gums. Gums are good. There's no, her mucosa is pink. There is no redness, no swelling, no exudate, no lesions. Lift up your tongue, looking at the roof of the mouth as well. Now you'll stick out your tongue and say ah. Tonsils are 2+ with no signs of redness, edema, or exudate. When she says ah, the uvula rises and falls with pronation, which signifies the cranial nerves 9, glossopharyngeal, and 10, the vagus nerve is intact. Stick out your tongue real good. Now move side to side. Tongue is midline with no signs of fasciculations. Cranial nerve 12, the hypoglossal nerve is intact. Next, I'm going to inspect her trachea. It is midline with no signs of goiter. I'm feeling. Is there any tenderness?
No.
Will you swallow for me? Trachea rises and falls appropriately. Now I'm going to assess her thyroid on her right side. If you would tilt your head forward and towards my hand. Next, the left side. Tilt forward and lean. Perfect. Thyroid exam appropriate within normal limits. Next, I'm going to palpate her carotid arteries, 2+ bilaterally. I'm going to listen with the bell of my stethoscope for any thrills, no thrills heard. Next, I'm going to have her flip around for me. We're going to look at her posterior chest. The posterior chest, first we're going to assess for any deformities, no signs of retractions, use of accessory muscles, no tripod breathing, no signs of cyanosis. Her breathing appears regular and unlabored. Now if you'll breathe in, lung expansion symmetric. Posteriorly, I'm going to feel for tactile fremitus. Will you say 99 every time? Good.
99, 99, 99, 99, 99, 99, 99.
Next, I'm going to percuss over all of the intercostal spaces. Appropriate. Next, I'm going to perform an egophony test. I'm going to listen as she says the word, says E.
E, 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 E.
Next, I'm going to perform that was the egophony, the bronchophony. So will you say 99?
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Appropriate. Now whisper pector colloquy. So you'll whisper the number 99.
99, 99, 99, 99, 99, 99, 99, 99.
No adventations, lung sounds, wheezing, audible, posteriorly. Next, you will flip around. I'm going to listen or inspect her anterior chest. No, it is symmetric, no signs of respiratory distress. I breathe in and out. Good. Chest rises or lungs expand symmetrically. I'm going to perform tactile fremitus. So you say 99.
99, 99, 99, 99, 99, 99.
Good. And then I'm going to listen. No adventitious lung sounds audible anteriorly. Next, I'm going to perform her cardiac assessment. I'm going to listen to her aortic valve, which is at her right sternal border at the second intercostal space. I'm listening with my diaphragm first, then I'm moving to the second intercostal space at the left sternal border for the pulmonic valve, the third intercostal space at the left sternal border for the Erb's point, fourth intercostal space at her left sternal border for the tricuspid valve, and then at the fifth intercostal space at the mid-clavicular line for her mitral valve. I'm listening at all of this with my diaphragm as well as my belt, aortic, pulmonic, Erb's, tricuspid, mitral. At the mitral valve, I'm also listening to the apical and feeling for the apical pulse. I'm listening to the point of maximal impulse pulse for 1 minute. Heart rate is 65 beats per minute. S1 and S2 heard, no adventitious heart sounds audible. Next, I'm going to have you lay down. At 30 to 40 degrees, I'm assessing for JVD distension, no distension. I'm inspecting for any heaves or lifts. I'm palpating the aortic, pulmonic, herbs, tricuspid, and mitral valves for any thrills, no thrills heard. I'm listening with my diaphragm, aortic, pulmonic, herbs, tricuspid, and mitral. I'm also listening with the bell, aortic, pulmonic, herbs, tricuspid, and mitral. I am going to next assess her abdomen. The abdomen is flat, appears symmetric. I'm going to percuss. I'm going to also take her right lower quadrant, right upper quadrant, left upper, left lower. Bowel sounds are normal active. I'm listening over the aorta, renal arteries for any thrills or brutes. So the renal, iliac, inframoral, no bruise audible. Next, I'm going to percuss in all 4 quadrants. For resonance, it is appropriate. I'm going to lightly palpate her abdomen. Any tenderness?
No.
No masses or deformities or herniation visible, felt upon exam. I'm going to assess her on her left side for her spleen by cupping under her rib cage. Spleen unpalpable on her right side from her mid-axillary line at the bottom below her rib cage. Palpate up to palpate the liver. Liver is unpalpable. Next, I will have her sit up. So if you sit right there, I'm going to attest for CVA tenderness. Is that tender?
No.
No. Any tenderness?
No.
No. Next, just flip forward for me. Thank you. We're going to move on to her musculoskeletal exam. So I'm going to start with her joints. I'm looking at all of her fingers. I'm looking at her wrists, her elbows, and her shoulders. I'm looking at her toe joints, her ankle joints, her knees, and her hips. Any tenderness?
No.
No tenderness, no swelling, no deformity, no nodules, and the joints are all symmetric bilaterally. I'm going to assess her capillary refill on her fingers. All 10 fingers are less than 3 seconds. Her radial pulses are 2+ bilaterally. The capillary refill in all 10 toes is less than 3 seconds bilaterally in lower extremities. At the tops of her foot, I'm feeling for the dorsalis pedis pulses. In her ankles, the posterior tibial pulses. Pulses are all 2+ bilaterally. Next, we'll start assessing her range of motion. So, we'll start with the fingers. So if you'll just follow my lead, we are going to flex your fingers down, extend them up, hyperextend them, spread them, abduct them, adduct them. We're going to thumbs in, thumb opposition. Good. Now we're going to rotate our wrists down, extend them up, hyperextend them back. We are going to ulnar deviate outwards, radial deviate inwards, rotate our wrists. Range of motion in wrists and fingers is appropriate. Elbows, we're going to flex your arms up, extend them back. Range of motion in your elbows appropriate. Now for the shoulders, we are going to flex your arms up, your shoulders up, extend them back, hyperextend them. Now if you'll put your arms in, internal rotation, and then above your head, external rotation, good. Now I want you to abduct your arms up, and then across your front, adduct them across your body. Good. Next, we're going to circumduction of your shoulders. Range of motion of shoulders is appropriate. I'm going to test grip strength, so if you will squeeze my fingers, grip strength 5 out of 5. And if you will push and pull against my, push your biceps and your triceps, flexing, extend them, elbows against my arms, strength is 5 out of 5. Now we'll test your shoulder strength, so if you will abduct against my arms, now adduct inward, shoulder strength 5 out of 5. We are going to look at your range of motion of your toes. Now flex your toes downward, extend them up, hyperextend them, abduct them, adduct them together. Good. Now we're going to dorsiflex our feet. Plantar flex down, dorsiflex them up. Good. Now invert your toes. Good. Exvert your ankles, rotate your ankles. Ankle and toe range of motion appropriate. Now I want you to dorsiflex up, plantar flex down, ankle strength 5 out of 5. I would like you to flex your knees or extend your knees against my resistance, both sides. Good. Now flex them in, extend them out. Good. Knee strength 5 out of 5. Now checking hip strength. So if you will abduct your hips out and adduct against my hands. Good. Hip strength 5 out of 5. Now go stand up. We're going to assess range of motion of your hip. So you're going to flex your leg forward. Now extend your hip back, out, hyperextend. Good. Abduct, adduct, circumduction. Internally rotate, externally rotate. Good. We would do that bilaterally. Next, your knee, we're going to flex, extend your knee, hyperextend. Good. Bilaterally, we would do that. Next, if you'll turn to your side, I'm assessing her spine for any curvatures. It is perfectly aligned straight. If you will, lean forward, no signs of scoliosis. At this point, we're assessing lumbar flexion. Now stand up straight. I would like you to hyperextend, extend, hyperextend back, lumbar extension and hyperextension assess. Now I want you to face forward. We are going to laterally rotate to the right. Lateral flexion is intact. The lumbar spine, we're going to rotate. Good, our hips. Lumbar rotation intact. Next, we're going to check cervical range of motion, cervical spine range of motion. We were going to flex your chin down, extend your head back, hyperextend it. Now look forward, go ear to shoulder, lateral flexion, nod, no, rotation, cervical rotation intact. Next, have heel to heel, cross your arms, eyes are open. We are going to close your eyes, good, no sway, Romberg test negative. All right, open your eyes, take a few steps forward. Gait is tandem and steady, turn around, good. Now we're going to hop on both feet, good, hop on right foot, hop on your left foot, appropriate. Now if you will sit back down on the table, we are going to assess your deep tendon reflexes, brachioradialis, bicep, tricep, patellar, Achilles, and Babinski. We've done that bilaterally. They are 2 plus normal. We were going to assess her cerebral coordination by doing the serial finger opposition. So thumb to each 4 fingers. Good. A finger or hand flip flop. Rapid movements. Good. Other hand. Appropriate. Now if you will use your right hand to track my right finger. Good. Good. Finger, finger. Appropriate. Next, I'm going to assess the vibration at her ulnar prominences. Can you feel the vibrations?
Yes.
And the medial malluses.
Yes.
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 And I believe that concludes my assessment. Thank you.